So hello all, and thank you for joining us today on this series of our Brain Health seminars here. With me today, I have Jennifer Brush and Kim Hai with us, and they're going to be discussing dementia and driving and everything that goes along with that. Without further ado, I'll turn it over to Jennifer and Kim.
Thank you very much. I'm Jennifer Brush, and it's great to be here today. Kim is joining us as our special guest. She's a certified occupational therapist, also a certified fall specialist, and she's also a specialist when it comes to driving. So she's going to talk to you about, answering the question that we often have about, am I safe to drive? Is my loved one safe to drive? What's a driving assessment all about? And those of you that have joined us before for a brain health series, welcome back. If you are new to this and you haven't met me before, I support Kendal at Home in helping their members and who have cognitive impairment, and supporting both members and their families in any issues related to cognitive impairment. I'm a researcher in the area of dementia, and I'm also a speech language pathologist. So I'm going to share my screen, and before Kim talks with you today about driving, I want to talk to you a little bit about the brain and about memory. This is our brain health series. We try and give you updated information about not just the brain, but how you can stay healthy and engaged in your life and maintain your mental fitness. And a lot of people are a bit confused when it comes to driving and memory impairment, because people seem very physically able to drive. And sometimes it's hard to tell when someone might be cognitively not able to drive. So I wanted to take a few minutes and talk to you about memory, and specifically about long-term memory. Because the act of driving certainly involves both short and long-term memory, but primarily our long-term memory. So long-term memory itself is the process of transferring information from our short-term memory to our long-term memory. And this involves both encoding and consolidation of information. And it's a function of time. So the longer the memory stays in short-term memory, the more likely it's to be placed in long-term memory. The more we are exposed to information, the more likely it is that we will be able to transfer that information into our long-term memory. So memory is a very complex thing. We've had sessions before that you can go back and listen to that are just about memory. It involves different regions of the brain, different systems within the brain. But the final stage is going into long-term memory, where it's stored for later recall. And long-term memories are classified either as explicit or implicit memories. And we call this also declarative or procedural memory. And I want to talk about the differences a bit, because it does impact what Kim's going to talk about today with driving. So declarative or explicit memory is our memory that involves facts, concepts, and events. It's things that are consciously remembered. Okay? Memories can be recalled, okay, where they're spontaneously retrieved from our long-term storage. So for instance, if you're reminiscing about a trip that you took, okay, and this is more of a conscious recall. Memories, there's also recognition, and that requires less effort. That's more of this sense that you've previously encountered or learned that information. Okay, that feeling that something is familiar. Okay. The areas of the brain that are responsible for our declarative memory are primarily the prefrontal cortex and the hippocampus. Okay. And if you recall from our previous conversations about Alzheimer's disease and dementia, declarative memory in the hippocampus is the first area of memory, the first type of memory to be impaired in Alzheimer's disease. Okay. The hippocampus is one of the very first areas of the brain to be impaired in Alzheimer's disease. We see shrinkage of the hippocampus over time. And so the declarative memory system is the first memory system that's impaired. Okay? And in our declarative memory, we have a variety of different subsystems. So we have episodic memory, that's our recall of life events, what's happening around you. That's the very first type of memory to be impaired in Alzheimer's disease. As the disease progresses, it affects semantic memory, which is our general knowledge. It's also our word finding. So when people start to have trouble thinking of words, they might lose content words in their speech. That's semantic memory impairment. Other areas of impairment are autobiographical information. That's information about yourself, your life history, your identity. That information tends to hang on longer than the other memories. But another type of declarative memory that's impaired very early on in dementia is spatial memory. Okay? And that is things like remembering the route to drive home or where a gas station is located. So that is your cognitive mapping. Okay. So this is all stored in the hippocampus, an area that's very sensitive to the effects of Alzheimer's disease. Okay. Memories aren't stored as perfect records either. So it's as if extra bits of information that weren't there when the memory was first laid down are added to the process. And when someone's impaired with dementia, their brain is unable to access all of that information, and the brain, without really knowing it, without really doing it on purpose, the person isn't consciously doing it, their brain makes up information to fill in the gaps. So oftentimes what people are recalling is not accurate information at all. And so you may have a conversation with someone, it might seem like they're making something up. It's their brain filling in the gaps for them. Now there's another kind of memory that's implicit memory or procedural memory. And this is our memory for completing motor actions, overly learned behaviors. It's how we do something. These are remembered unconsciously. Okay, they're very, very automatic. Okay, these are knowledge of skills about how to perform a task, riding a bike, playing an instrument, typing. Okay, any of your activities of daily living, taking a shower, washing your face, eating. These are things that we just do. Okay, just like the procedure for driving a car, okay, is very much a habit. We don't think about it when we get in a car, we just do it. Procedural memory is stored in a different part of the brain, and this part of the brain is not affected by Alzheimer's disease until much later on in the disease process. So what we run into are individuals who automatically recall the procedure for driving, okay, but lack the spatial awareness and the problem solving and the insight for making judgments, okay, that are required for driving. So that is why someone may seem like physically they're very capable of doing this. So that's just a bit of an overview or context for what Kim is going to talk about today. So I'm going to turn this over to her. And Kim, if you want to share your screen.
Okay.
And when you're speaking, I'm going to just mute myself and turn my camera off so you have the full attention.
All right.
There you go. I can see that, no problem. And we're able to see you as well.
Okay, great. All right. Well, thank you very much for having me on today. Again, my name is Kim High, and I have been an occupational therapist for about 30 years now. And half of that time, I've spent my career dealing with older drivers and driving safety. When I started out my career in driving rehab, I saw a lot of people of all different ages, not just older adults, helping people with, if they had certain injuries like spinal cord injuries or stroke and that sort of thing, teaching them how to use assistive devices so that they can continue to drive independently. But that has shifted over the years, where my primary focus at this point is on older drivers and those that may have starting to have some cognitive challenges. So in terms of my objectives today, I want to provide you with some insight into how and when to intervene when it comes to driving and giving up driving. Give you some education on what a driving evaluation involves. So I'll go through the steps of what I do when I evaluate someone for driving. Give you some insight into the role of the Medical Advisory Board. So I'm not sure where you all are coming from. I'm in Maryland, so we do have a very active Medical Advisory Board to counsel drivers and what needs to happen in terms of their driving when they start to have some challenges medically. And also provide you with some education on what we as professionals can do and individuals working with the aging population to help older drivers stay safe and maintain a level of independence. So when it comes to driving and when to intervene in driving, certainly the primary focus for any intervention, especially when we're dealing with our older adults, it should be a very well balance between independence, safety, and also maintaining dignity. So oftentimes you may ask the question, well, when is it, the good time to have that conversation about driving? My answer to that would be, ideally, you want to begin that conversation early. You don't want to begin the conversation when you start to notice changes. So you want to certainly intervene before it becomes a big problem. So you want to be proactive, not reactive. And again, starting those conversations early so that you can, establish a pattern of having that open dialogue. And so also when you are preparing to have that conversation, there are some things you may want to take into consideration. Certainly you want to get the facts. You want to learn about different warning signs that you might started to notice. Look at the person's behavior and observe them with their behaviors in driving. Are they starting to, make some changes? Are they starting to limit places that they're going? If you notice some changes that they're starting to do about their driving behavior, you also may want to start to address those concerns with a physician. Oftentimes older adults, value what a physician might have to say. Investigate some alternatives to driving. So once a person can no longer drive, you don't want to leave them high and dry and they are left without an ability to get around. So certainly look into ways that a person can still have some mobility within their community and wherever they need to go. And most foremost, you want to be supportive. The thought of having to give up driving is a very, very difficult thing to take on. So certainly you want to be as very supportive as you can be. So again, the driving should be a team approach. And oftentimes you may want to start with the physician. And again, most older adults would probably value the advice of their physicians. There is a guide for physicians to follow when it comes to older drivers. You may be able to visit this website. So doctors should be aware that they do have some guidelines that they can go by to make sure that they're giving the best advice in terms of driving ability. So a physician's plan for older driver safety, you definitely want to start by performing an initial screen. Certainly you want to observe the client. And when we say observe the client, maybe as they're coming to the doctor's office, notice any changes with the person, outward appearance. Do they have some balance issues when they're walking? When you're talking to them, do they appear to be confused or not answering questions appropriately? Certainly, you want to be alert to any red flags. Medical conditions, certainly doctors know all about the different medical conditions that can impact driving. Is there a history of stroke resulting in some type of weakness and balance issues? Are they diabetic? And certainly we know that diabetes causes numbness, and you might have peripheral neuropathies, some numbness in your lower extremities, which might have an impact on a person's ability to control the pedals on a vehicle. And again, reviewing the systems of the body, looking at the musculoskeletal system. Is there weakness involved? Signs of weakness. The nervous system, looking for sensory problems. Cardiovascular, are there circulation problems? So a doctor should be able to assess all of different types of systems in the body. Medications, we know that a lot of older adults are on medications that might impact driving safety, and you want to know if there are any side effects from the medications and review any drug interactions, because certainly with all the different types of medications older adults may be on, there may be some drug interactions where the drug may be not as effective, or it's causing more problems and it's too strong. So again, looking at medications. Again, we talked about the review of the different systems. And again, the patient and family concerns. Are family members starting to notice some changes in the older adults driving? They probably are the first ones to notice things because they are around them more often. And you may want to bring this to the attention of the doctor. So once the doctor has, looked at all the different medical systems, you want to determine if the person is at risk, and you also want to look at some of the functions of the person, looking at their vision. Driving is probably 99.9, if not 100% of driving. You need to have good vision when it comes to driving. Does the person have cataracts? Is there clouding of their vision because of the cataracts? Do they need to have the cataracts removed? Do they have glaucoma? Certainly we know that glaucoma will affect one's peripheral visual field. So, and that's very important in terms of driving. You need to be able to see out your visual field to make those looking out the corner of your eye to make sure something isn't coming at you. Do they have macular degeneration? That's another vision condition, eye condition, where your central vision is impaired. You really can't see things that are in front of you. So there may be some distortion in that area. And look in terms of cognition, do they have problems with their ability to focus or pay attention to things? Can they plan and make good decisions on the road? In terms of motor function, you want to look at their ability to move around and move about. Do they have limitations in their range of motion in their upper extremity? Is the range of motion so limited that they are having trouble turning a steering wheel? Do they have history of falls? And there is some correlation between falls and getting into accidents. So once a physician does all of his assessing, there may be some needs for some medical intervention for diagnosing and treating. So you want to rule out a number of things. That's why it's important to do, a full assessment on a person. And if there's some intervention that can be made, then, if it's just maybe a vision problem, correct the vision. If there's some, motor function problems, if they need therapy or something of that sort to improve their strength or their balance, there may be some issues in that respect. When it comes to cognition, sometimes different diagnoses can mimic dementia. Is there some depression going on? So does an area like that need to be addressed? So that's why it's very important to make sure that you are looking at all the parts of the person to make sure that is there any intervention that can take place to kind of make sure that these are some areas that can be corrected in order to make a person safer. So, however, if the deficit cannot be resolved, then at that point, they may need to refer them to a driving rehab specialist for further evaluation, and that's where I come into play. One thing that a person might do is their own self-assessment to see if they want to know if changes are starting to take place within themselves. So one thing might be they might notice, hey, I can't find my way of getting to the grocery store. I've been going to the grocery store, the same grocery store over and over, and now all of a sudden I'm having trouble getting there. That's definitely a red flag if you're starting to get lost in places that are familiar. You start to have other people worry about your driving ability. If somebody comes and brings something to your attention, other people are starting to notice that there are some challenges with your driving. Then you can kind of assess, yeah, maybe some people have been coming up to me and telling me that I'm starting to have some problems. You're noticing that cars are appearing out of nowhere. You're driving too fast or driving too slow, and somebody is starting to honk at you because you're doing something improperly. You're starting to feel overly tired after driving. You get stopped by a police officer because you're doing a maneuver on a road that is not safe or improper and putting yourself and other people at risk. You don't like driving at night, or intersections appear to be too busy, making left-hand turns where there's no light. You're starting to have some challenges there. Are you having some near misses? So if you start to do a self-assessment, you may be able to, on your own, see that you're starting to have some problems. So here are some questions that caregivers can do, ask themselves, and when they're noticing possibly some changes in their loved ones. Maybe you have been driving with them, you're in the car with them, and you notice that they're not obeying all the traffic signs and signals. They're driving too slow or too fast. You're noticing that they're getting lost. They're having some trouble staying in their lane. They have very slow reactions. Something is happening, and you need to hit that brake and stop on a dime, and they're not doing that. They're slow to process information, and they're really not focusing properly on all the things that are happening around them. They're making very poor decisions. They've gotten some tickets, or you notice that they tell you they almost got into an accident. They may be having some fender benders. One of the things that I do before I begin an evaluation, when I take someone out and I take them out in their vehicle, I always do a walk around the car to see if there's a number of dents and dings, and I ask them about it. And if they tell me, I don't know how that got there. So there may be some issues that certainly there is some evidence that things are starting to change when you're noticing some damage to the vehicle. So let's talk a little bit about the driving evaluation that I go through when someone is referred to me. And oftentimes a referral can be made from many different sources. Sometimes it can come through our motor vehicle administration. It can come from a doctor. I have had, family members contact me to say that they wanted to have their loved one evaluated. So the driving evaluation is typically a two-part process. We start with a clinical evaluation followed by an actual behind the wheel on the road assessment. And again, this is performed by an occupational therapist that specializes in driving rehabilitation. So these are the areas that I cover when I do a driving evaluation. I start off with a basic vision screen. I'm looking at the person's visual acuity, how clearly they're able to see. And with visual acuity for Maryland, there are some standards that the person has to have a visual acuity of 20/70 or better. And that's best corrected vision in at least one eye. They need to have some good peripheral visual field. So in terms of Maryland, the peripheral visual field is at least 110 degrees. So they need to have, again, at least 110 degrees of peripheral visual field to be safe with driving. I also look at their color perception. Can they be able to decipher, different colors and changes in a traffic light? Sign recognition is another thing that I look at. Are they able to identify different traffic signs and signals in order to, again, be safe on the road? In terms of cognition, I do a number of tests that look at one's memory, their attention, and their ability to solve problems. So there are a series of tests that I go through when I'm doing that. One test looks at the ability to just focus your attention on one thing at a time. I'm looking at a test that looks at one's ability to be able to shift and divide their attention to between more than one thing at a time when driving. And certainly we know that when we're driving, we're not the only ones on the road just driving down the street by ourselves. There are a number of things that we have to pay attention to all at one time. Somebody's about to cut you off. The traffic is heavy. You need to slow down. You got to make sure you're not getting too close to the car in front of you. The light's about to change. So many things are going on at one time that we have to be able to make sure we can figure all of that stuff out in the moment. We're looking at visual perceptual skills, and that's the brain's ability to see things, figure out what's being seen, and make those quick and accurate decisions about what's being seen. So oftentimes when I give an example of that before I do my evaluation, I tell the person, okay, say for instance, you're in an environment, there's a stop sign, but the stop sign may be partially blocked by tree limbs. Even though you don't see the full stop sign, you know there is a stop sign and you still have to stop. So you have to be able to pick out information in the environment so that you can make those good decisions. Spatial skills, we're looking at how well a person can judge their distance between other cars when they're driving. Are they getting too close behind other cars? Do they have trouble staying centered in their lane? When they're turning corners, are they getting too close and almost bumping into the curb? When they're trying to park, are they having trouble lining themselves up in a parking space? So those are the types of things that I'm looking at when I'm judging spatial skills. Depth perception, we're looking at how close or far away that you can judge when you're driving. So those are some of the areas that I do on a clinical assessment. And these tests that I do on a clinical test, they're simulated. These things are giving me some information before I actually take a person out on the road. So I also look at one's brake reaction time. So I have a piece of equipment where I'm timing how quickly somebody can get their foot from the gas to the brake in a simulated fashion. And also the last thing I look at is their functional ability. I'm looking at their range of motion, their movement in their arms, their movement in their legs, the ability to turn their head to view blind spot areas. I look at eye tracking skills. How well can they keep their eyes on moving objects coming towards them, objects moving away from them, and shifting their eyes back and forth between objects. So all of that is a part of my clinical evaluation. Again, this gives me information to look at to determine what I might see once I take a person out on a road. And so I'm looking at this clinically so that I can be prepared to see if anything that I see clinically is carrying over into the actual driving performance. So next is the actual behind the wheel evaluation. I used to have a practice where I had people come to my office. We did the clinical evaluation in my office, and they drove a vehicle that I provided. My vehicle had a brake on my side, where the passenger side. So if I needed to, stop the person in a situation, I would be able to do that. But now I have changed the way that I do my evaluations because I focus primarily on older drivers that are having some cognitive challenges. I try to eliminate as many biases as possible. So I allow the person to drive their own vehicle in their own environment. So I don't do as much of a pre-planned route like I used to. The route is tailored to the person so that I can see exactly where they're going on a regular basis. We plan the route based off of the number of places that they go to. And I like to see a variety of environments that they drive in, some busy roads, some windy rural type roads, some residential areas. If they drive on the highway, I like to see their highway driving. So we do a comprehensive evaluation. Again, within that hour, I should be able to get enough information about the different environments that they're driving in so that that can help me to make a determination about their skill level. This here is some of the devices that I used to train people on when I was doing some driver rehab training. This on the left is a steering knob for someone who may needed to drive with using one hand, and the other one is a hand control where I taught people how to drive with spinal cord injury. So that's not so much what I do at this point. So before I get to talking about some of the other slides, but once I complete the evaluation, there's typically 3 outcomes that can be as a result of the evaluation. So one could be, once I did the clinical, the behind the wheel, actually the person did very well. I didn't really see any problems with their driving. And so I'm documenting as I'm going along, making notes so that I can bring it back to the person so I can say, remember X, Y, and Z happened. And sometimes in the moment, if they are making some errors, then I will point certain things out to them so that I can see if they're making some correction the next time for the next destination that we're traveling to. So we come back and we have a discussion about what took place. Again, one scenario could be that the person did fine, didn't see any problems. They can continue driving as they had been. If they're starting to have some cognitive issues, I make the recommendation that they be reevaluated so that we can see if there are any changes that are taking place over time. So usually within about a year or so, and I talk to the family to make sure that things are still, on point, and if they need to be reevaluated, then we talk about when that needs to take place. The other thing could be that if they need to make some modifications in their driving, it may be early on in the cognitive process that a lot of changes hasn't taken place yet, but they may need to make some adjustments with their driving. Maybe stay off the highway, strictly stay in those familiar environments, and don't venture into any place that is new or unfamiliar to them. Drive during the daytime only. Again, no driving at night. And again, if they can stay in a confined area, they tend to do a whole lot better, especially those that are starting to have some cognitive challenges. And so once we complete that, we make sure that, our medical advisory board doesn't have to get involved, because they will get involved if I make the recommendation that a person needs to give up their driving. And that's the last scenario. If I find that they're so unsafe, that they're making so many driving errors, they're not able to make those corrections after I pointed certain things out to them, then I may have to refer them to the medical advisory board to have their driving privileges taken away. That's a very difficult thing to have to be done, but it needs to be done. I have to err on the side of safety and caution, where if I know that you might be at risk of hurting yourself or someone else, then it's my job to make sure that, as best of my ability, that doesn't happen. So our medical advisory board will certainly weigh heavily the recommendation that is made by an occupational therapist. And so when that happens, they certainly will provide them with needing to get some additional information. They will have them have the doctor complete some information, and also they have to do a self-assessment as well to look at some of the changes that they may be experiencing. So it's a comprehensive look at all the different changes that may be taking place before they make that final decision that a person's license and their privileges need to be suspended. So a person may not agree with what's being said, so they do have an opportunity to go through a re-examination. And if they can prove that, hey, maybe this wasn't a good day, that we can have another opportunity to see if we can be re-examined, then there are some parameters and some guidelines that the MVA will go through to see if a person can be re-examined, to see if they can have their driving privileges reinstated. So in Maryland, there is a self-reporting process. We are a voluntary state, so if you start to have certain changes in medical status, it's not automatically that you go in and you say the doctor or the MVA says you must do this. We are a voluntary self-reporting state. So if you have these medical conditions, and these are just a handful of the diagnoses that they list as conditions that need to be reported to them. Certainly dementia is one of them, stroke, diabetes, if you have a loss of consciousness, cardiovascular disease, and seizures. These are some of the more popular, I would say, diagnoses that should be reported to our MVA. our MVA's Medical Advisory Board. So the physicians and other medical professionals, we are authorized, but we are not mandated to report certain conditions. We are protected by privacy laws because when we disclose information without the patient's authorization, we're not held, lawfully held to a standard where we're going to get in trouble, I should say. So we are allowed to report certain things to the MVA about a person's medical driving status, so that certainly information can be provided so we can get persons off the road if that needs to happen. Some of the different ways that we can keep older drivers safe. This is a program called CarFit. This is through the AOTA, AARP, and AAA, where this is a process where the occupational therapist is involved. Sometimes you might see these types of programs in facilities, independent living facilities, where there's a setup where people can bring their cars, drive through, can get checked out to make sure that they're still safe, making sure that they are fit properly in their vehicle, they are the right distance behind the steering wheel. Are they positioned high enough over the steering wheel so that they can see? They know how to adjust their mirrors properly so that they can have the best field of view when they're driving. So this is a program that allows a person to continue to maintain a level of safety and get checked out. So if the decision is made that a person should no longer drive, we need to make sure that the person has some alternatives to driving. Is there mobility services? Now we have Uber and Lyft, so that might be a possibility, having some taxi access. So certain people may live in certain facilities where there are transportation services available to them. It may be limited, but there is a way for them to still get out and about in the community, to get to the grocery store, a doctor's appointment, and things of that nature. Some people have good public transportation systems in their area if they're still functional enough that they can use public transportation, and certainly relying on family and friends. Now, here are some resources that you can certainly look into in terms of getting some additional information about when it's time to make that decision about driving and giving up driving. So here we have the Hartford is an organization that comes up with a number of different publications. Here is one of those publications that, if you can see it here, is like, we need to talk. So it gives you some guidance on when to begin the conversation, how to go about having that conversations. They have publications on people that have dementia and may need to, give up driving sooner than later because there are some challenges that are taking place. So it really helps you to go through how to have that conversation. AARP has a drive safety program so that you can get some additional information on. There's something called a road-wise review where you can really assess your driving skills. This is something that can be done online. And AOTA is certainly the Occupational Therapy Association. They have a whole list of resources and information about driving and driving safety, and the Association for Driving Rehab Specialists. This is an organization that could provide you with, in your area, some of the different driving rehab programs if you need to seek someone out that's close to where you live, so that certainly you can get some additional information. So with that being said, here is my contact information. This is probably the best email address to reach me, and this is my cell phone, so I don't mind you calling me personally to get in contact with me if you have some additional information. If there's any way that I can certainly help you, I'm willing to do that. And we have plenty of time for questions, so I will stop sharing my screen, and if you would like to open up to questions, here I am.
Thank you very much. That was very good. Very, very helpful. Please don't feel like you have to type things in the chat. If you'd like to, if anyone has any questions or comments, you can unmute yourself. You're more than welcome to type things in the chat, but if you'd like to unmute yourself, if you'd like to share your video, we'd love to have your questions today.
Yeah, so at the bottom, there should be a raise hand feature for any attendee wanting to ask a question, not in the chat. Obviously, if you want to stay more anonymous and not come in, we can answer anything that comes through the chat or the Q&A. But if you want to ask your question in person here, please raise your hand and I'd be more than happy to promote you in to the webinar here. So Kim, just a question that I have on it. There are obviously some things that often get overlooked, whether it's something that we don't want to admit to ourselves on it, or about our family member, or whatever the case may be. What are things that you think often goes overlooked that we often say might not be a big deal, but end up being a bigger deal than we realize?
So oftentimes, and people, if they don't have an opportunity to, when it comes to driving, be in a vehicle with somebody that's driving on a regular basis, you may just assume that they're doing fine. And certainly that's one way of really things are being overlooked. And like I always tell people, if you, as people are aging, take a moment to get in the car with them, to drive with them, so that you can see for yourself, so that you're not overlooking some of the changes that are, are coming down the pike. And oftentimes, when the roles start to be reversed a little bit, the child, it seems like they're the parent now, and certainly the adult doesn't, the parent doesn't want to hear from the child telling them what to do. Then that can be, a tough thing to have to deal with. So, like I said, it's very important to keep the lines of communication open. Don't wait until the problem happens before you want to, intervene. As I talked earlier, make sure that you have those conversations often and early, so that you can start planting the seed, and things don't get overlooked to the point where, okay, now something needs to be done.
I can only imagine, as you're talking about that, of being that adult child, getting in that passenger seat and almost taking them through the driving lessons that they took you through.
How about
like
yes.
I'm thinking about that in my head. I don't know how I would feel on that, sitting in that shoes there, where it's almost like when I was learning driving, my mom would freak out at every time. She's like, slam on the brakes, like don't do this, and like holding on for dear life
Right.
on things. And it's almost like reverse, and it's okay. Well, you did this to me, now I get to do this to you.
It certainly seems that way, but it's a very, very challenging. And I do have people reaching out to me frequently, and sometimes people say, well, what if I gave them a GPS, and that if they're starting to have some cognitive challenges? And for me, believe it or not, I do not evaluate people using a GPS. Now, if and having a co-pilot in the car, meaning another person on the passenger side, directing them, telling them where to turn and where to go. If you cannot make the decision of how to get from point A to point B on your own, then definitely driving needs to be considered to be given up. So if you can't make those decisions on your own and independently, yeah, that's a problem. So when I notice that people will come to me, and I've had people once, and early on, I evaluated somebody using a GPS. Of course, if you make a wrong turn, the GPS is going to reroute you. It rerouted the person in a construction zone, and they had cones and everything set up. This is a person that had some cognitive challenges, and they were not able to figure out how to navigate through that construction zone. So they were actually about to enter where the traffic was supposed to be coming out. So had I not been there, that could have been a disaster. So again, using GPS systems, I don't allow that when I evaluate somebody for driving. So, but those types of things need to be taken into consideration. and just to speak, from experience of some of this, I can tell plenty of stories if nobody has any questions, but when it comes to, the driving evaluation, when I'm seeing people that are having some cognitive issues, I always allow them to, again, drive in their environment and drive their own vehicle. When we plan the route, I let them, we go from one destination to the next. We'll stop once we get there so that we can have a conversation about how well they did and if I need to make any recommendations. Now, I've had people, I know that they're starting to not drive the route that they had intended to drive, and they just keep driving and driving and driving, and they never make it to the destination that they had intended. And I'll ask them, are you doing okay? Are you able to find the place that you're getting to? And at some point, they'll recognize that they're lost, and we do have that conversation that it's time to give up driving. I had one situation where a gentleman had to, his job was to get to the McDonald's. Now, there's almost a McDonald's on every corner in some neighborhoods. So he spots a McDonald's, and lo and behold, it's on the other side of the road. He's going to cross almost 3 lanes of traffic to get to the other side to get to the McDonald's. So yeah, so a couple of scary situations that I've been in where I had to really, if I wasn't there, then again, a disaster could have taken place. So yeah, that's why it's scary to think you may have to be in a car with somebody, but it's important to do that so that you can make sure that someone is maintaining a level of safety.
Absolutely. I'm not seeing any questions pop up. If you want to share one more story that you have, these are obviously very interesting too for us, because sometimes you might be in this situation where you don't necessarily know what you're thinking about. Like, as you mentioned there with the McDonald's story on it, you see the golden arches, you see your destination, and you want to turn, but sometimes you don't recognize, oh, maybe there's those 3 lanes of traffic. Is there another story like that, or the GPS story?
Now, oftentimes people may think because somebody is starting to have some dementia or cognitive challenges that they need to stop driving immediately. That may not always be the case. So I have some people where things are certainly early on in the process. I just recently evaluated, a woman, she's in her early 70s. She is having some cognitive challenges where she can't remember, like Jennifer was talking about, certain events and things like that. But she has the wherewithal to still know how to operate the vehicle and turn it on. But my job was to make sure that she can get from one destination to the next. She did fine. And as long as she stayed in the area and adhered to the recommendations that she stay in places that are familiar to her, then she was given a pass. So even though people are starting to have those challenges, they're still able to maintain a level of safety for a period of time. But I always tell them at some point that is going to change. So don't have that false sense of comfort that I gave you a pass this time, but there are going to be some changes that are going to take place. And one of the things that I can't stress enough is the one thing that's the line in the sand for me is, if you start to get lost in driving in familiar environments, you have to stop driving immediately, because you don't want to find yourself wandering into an environment that you're not familiar with. It's not safe sometimes these days. That you don't want to happen. In the winter months, certainly you don't want your car to run out of gas and it's cold and someone's looking for you. You always see those silver alerts in our area. Then you know that there's an older adult that has gotten lost, and you'll see the driver's license information in the car, make and model, going across, the highway to alert us that someone has gotten lost with their driving. So yeah. So again, there are opportunities where people can still maintain a level of safety, but keep in mind that at some point that will change. People sometimes go kicking and screaming. Others are willing and okay with having to give it up. But certainly you need to provide that support and look at those alternatives, because sometimes people still need to get around. They may have family that's out of town or out of state, and they're not close by. They may not have a large circle of friends that they can call on. So, and we don't want them to fall into a state of depression, because that's not going to be good either. So, and that oftentimes can happen if you take away someone's privileges too early. You don't want to do that. You want to make sure that if they can still drive and do it safely for a period of time, allow them to do that. But it may come to a point where it definitely has to be given up, and you want to prepare them for that as best you can.
That's good news too, where it doesn't necessarily have to be a cold turkey, clean stop, clean cut. There can be some areas where in that hometown that you've been in for 50 years, that you know the ins and outs of every single thing, you know where the potholes are going to be, etc.
Right.
That you can still be around those areas. But when you're doing the long, you can't really do long drives. You can't go necessarily to the next town over, 2-3 towns over, to where it's not as familiar, but you can still go and see your friend's house down the road and stuff, and feel comfortable doing that.
Absolutely.
I think
yes.
just like Kim said in the very beginning of her presentation, it's a balance of safety and dignity, right? And independence. We want to help older adults maintain their dignity and their independence for absolutely as long as possible. But we also want to keep them safe, and we want to keep the other people on the road safe as well.
Exactly.
So I think that's what we have to keep in mind. So thank you, Kim. It was great to have you today, sharing some really important information. And if anybody has any questions, from Kim, please feel free to get in touch with her. So thank you.
Thank you. Thank you so much for having me. Okay. Bye-bye.
All right. Bye-bye.
Thank you all for joining today, and we look forward to seeing you at future events.